Hello, again, my name is Kenya Wheeler, and I am the Deputy Field Director for California for Organizing for America. And on behalf of our State Director, Mary Jane Stevenson, and our Field Director, Mike Petzold, I want to thank you all for giving of your Saturday afternoon to come here and hear this great and engaging dialogue on the need for healthcare reform here in this country. Now I'm going to turn the mic over to Reid, and she will tell you a little bit more about Organizing for America and about how you can participate in healthcare reform.
Hi, folks. So you all know we're doing a National Day of Service on Healthcare, and I'm really, really proud and pleased to say that here in California we have over 200 events going on today. People are donating blood, people are volunteering at clinics, they're visiting veterans hospitals, they're getting educated and informed about what we can do about healthcare reform. And one of the really important things that we can do is to share our stories with each other. And that may seem like a small thing, like, well, you know, what does it matter about a story? But every president since Richard Nixon has tried to enact healthcare reform and failed, except for our last one. We won't mention that. The reason it's failed is because the national narrative gets steeped and full of insurance lobbyists and people who have a vested interest, a financially vested interest in perpetuating a system that disenfranchises you and I, that makes it so we can't choose our doctor, so we can't afford to get care, so that maybe we can get care, but it's not really that good. And so what we do when we tell our stories is we own that narrative, because this is our story. Our stories are about healthcare, what has happened to us, what's happened to our families, what has happened to people that we love. So I'm going to tell you very, very briefly about my story, because this is one of the ways that we can most effectively create change, by really being honest and being open about what healthcare reform really means to us. It's not just this idea out there. So I grew up in Boston. My mom's a social worker, and I grew up very much with an ethic of service, a value of service. That was pretty much the most important thing you could do, right, is to give of yourself. So my earliest memories are going with my mom to donate blood. And the first time I ever saw her cry was when a doctor told her she couldn't do that anymore. And she couldn't do it anymore because she was sick. And she wasn't crying because she was sick. She'd been sick for a long time. She was crying because she couldn't give that life force energy to someone else anymore. And she spent the next 12 years in and out of hospitals, in the emergency room several times a week. I spent most of my childhood in hospitals also, watching her pasty and pale in a bed and, cringing, and watching doctors and nurses and people who should have been taking care of her, who should have been treating her with respect, disrespecting her, and eventually they decided that it was all in her head, because it was very hard to diagnose what she had. So it took a long, long time to finally get a diagnosis. So she has a chronic illness. With the cost of the medicine and all of the hospital stays, my family had insurance. My father worked at Harvard, and so we had pretty decent insurance, but it was really, really hard for my family. If we hadn't had health insurance, we would have been definitely, absolutely out on the street, me and my brother and my mom being sick. She didn't always have access to quality care. Like I said, she was told in the emergency room by a doctor one time, "I hate people like you, get out of my emergency room." She couldn't choose the doctors or the hospitals that would have provided her the best quality care because they weren't in the network. So fast forward a little bit, my dad got a new job, and with the new job came new insurance and new choices. And she was able to look into treatments that weren't, experimental. They were out there, people knew about them, but she didn't have access to them before. So she got CPAP machines, so now she can sleep at night. She did some lifestyle changes. She got access to a new neurologist who gave her some new medications that absolutely changed her life. She lost 100 pounds, and it's been 3 years since she's been in the emergency room. So that's why I'm here. My mom's story is an unlikely story. She got better. She still has a chronic illness, but she's happy. She's not in pain every day. She doesn't go to the emergency room every day. She doesn't have to say to me and my brother, "I'm going to the hospital, I'll see you tomorrow." But it's not fair that my mom got that happy ending, and your mom or your mom or your mom, maybe they don't have that. So I'm here because of my mom, I'm here because of her story, and because I believe that it is absolutely unacceptable in a country where we have the best hospitals and the best doctors, that you and I and everyone else doesn't have access to them. So I'm standing with the president now, identifying these 3 top principles: that we can't be paying so much for health care. It's killing us. So many people that we know who are in the hospital, they're dying faster because they're worrying about how are they going to pay for this? What's going to happen to my family? Is my family going to be out on the street because I got cancer? It's unfair. It's unacceptable in America. It's unacceptable in America that we have great hospitals and people can't get into them. It's unacceptable. And it's up to you and I to make sure that the promises that President Obama made when he was a candidate, we heard him say over and over and over again that every American has the right to be able to choose a plan that is as good as the members of Congress have. You and I deserve that. People out here who come in to get help from Glide Church, who come in here to be fulfilled and be spiritually enlightened, all of us deserve that. So I want to ask you guys to stand if you know somebody who's sick and needs to see a doctor now. If you know someone who's absolutely drowning in healthcare debt, they got bills they can't pay, so you or somebody you know wants to be able to choose the right doctor, the right plan, the right hospital for you and your family. And I'm going to ask you to stand with the president now to say, we are going to make sure that we have healthcare reform in this country this year for all of us. Thank you.